All right. So welcome, everybody. Thank you so much for joining us this evening. This is going to be evening clearly of lots of engagement, and as well as being able to have your live questions as well as answers given to the most pertinent questions that you have. So altogether, the reason that we have come together for this is to, one, be able to give you the things that may create a barrier for you for finding out about the vaccine or for getting the vaccine. We really want tonight to be a decision aid. In addition to that, you know, it's MLK Day, happy MLK Day. And service is certainly the rent that we pay for the space that we occupy on Earth. And this is all about not only us creating a service to you, but also yourself, the information that you give, all the times that you guys have spread the flyer along for you to do the same thing after this event, to be able to spread the information that you have amongst your friends and amongst your families. The other thing that we want to do is just go over a few ground rules as well as some of the conflicts of interest, just to make a statement about that. We, all of us, myself included, are not receiving any gifts or payments from pharmaceutical companies, from biotech companies, from health institutions, or from any other private or public institution for tonight's event. As well, all of the information shared here will solely reflect the views of ourselves, as well as the research that we have found nationally available and our own personal experiences. Next, before I introduce our illustrious panel, I just want to let you guys know that tonight will also include some opportunities for us to be able to ask you guys some questions towards the end of the event. And now, with all that said, I think it goes without saying, COVID-19 has shown to be a deadly pandemic with over 92 million infections in the US and over almost 400,000 people, US citizens, who have died. Certainly for our community, we have been disproportionately impacted with over 50,000 African Americans lost to COVID-19, moms, dads, fathers, and including children lost to COVID-19. So the bottom line for us is we feel, as part of the medical community, that this vaccine is one of the biggest ways that we can begin to fight and to stop the spread of COVID-19. With that said, let me introduce our awesome panel of Black physicians. And I'm gonna just start with Dr. Jeremy and Jermaine Hostrow, and they are from internal medicine residents. They are from Chattanooga, Tennessee. We also have Dr. Gini Ikwezuma, and he is one of our OBGYN residents, and he hails from Hotlanta. Then we also have Dr. Donald Okoye, who is one of our Med Peds attendings, hailing from New York City. We have sharing the screen, the second set of shared screen members, Dr. Cindy Agu, as well as Dr. Elizabeth Johnson. Dr. Cindy Agu is one of our neonatology fellows, and Dr. Elizabeth Johnson is one of our pediatric attendings. We also have with them, or next to them, Dr. Jonathan Williams, and he is one of our infectious disease attendings, one of the experts hailing also from Detroit, Michigan. Dr. Randy McPherson, as well as Dr. Lauren Urota, are sharing a screen, and both of these wonderful folks are family medicine attendings. Then we have Dr. Kanisha Evans, who is an infectious disease control fellow, hailing from Detroit, Michigan. And I'll go back to Dr. Cindy Agu, hailing from California. I forgot to mention that, as well as Dr. Elizabeth Johnson, hailing from Virginia Beach, Virginia. Without further ado, let's hop right into answering and getting some questions taken care of. All right. So one of our first questions I'm going to ask our Dr. McPherson to handle, and that is the question of what are the similarities and differences between the Moderna as well as the Pfizer vaccines for COVID-19?
So both vaccines, Pfizer and Moderna, are very similar, and one of the main similarities is they're both mRNA vaccines. They are both 95% efficacious in preventing severe COVID-19 disease, as well as they are both giving with 2 doses. Some of the differences is Pfizer 2 doses is 21 days in between both doses. Moderna is 28 days. Pfizer also requires a much cooler storage temperature as opposed to Moderna, and Pfizer is approved for ages 16 and up, whereas Moderna is ages 18 and up.
All right. Next we have, it looks like we have a couple more questions. I think we have the first, one of the first questions dealing with the COVID-19 vaccine and understanding whether or not we will have a quote unquote choice. And if that's truly important, Dr. Kenesha Evans, we'd have you to kind of address that question.
So good question. I'm honored to be here. We are enjoying all of the lovely people that are here and trying to network with what we have going on here. But in terms of this question, it's a really good question. And at this time, I honestly would say that we don't actively know the answer to that, I would say is the best way to answer that. Geographically speaking, there is a distribution in terms of how much Pfizer goes to, how much Moderna goes to, based on Wayne County versus Macomb County versus Oakland County. But I would stress the importance of understanding the need and the necessity for us to vaccinate, given the complexity of the numbers that we have now in terms of the number of people that have COVID, as well as the number of deaths that we have. Right now in Oakland County, we are number 8 in the number of deaths as of to date.
Got it. So bottom line, it looks like Dr. Okoye would like to add something to that. Go ahead, Dr. Okoye.
Yeah, it's a great answer. Welcome everyone, all the attendees. Yeah, I just wanted to add a little bit to it. The current knowledge, we have some information in our own locales in terms of the distribution. We know that with the phased distribution of the vaccines, that we expect that certain locations will be able to have access to the vaccine. And then based on the phase, we have the criteria for people who have access to that vaccine, those vaccines. So at a certain time period, we can say, you know, who can get the vaccine. But because of the lack of a bit of knowledge on, I mean, we just, it's kind of early, so we're not circulating it as widely as possible. And so it's limited to certain sites. And so we can't say 100% that everybody can get access to whichever vaccine they want. As Dr. Evans wonderfully mentioned, best thing to do is get whatever's available to you. They're equally efficacious.
Got it. Appreciate that. We do have some questions coming in. And one of the questions deals with age ranges and why, if you can discuss a little bit further, the different age ranges for the Moderna as well as the Pfizer vaccine.
And answer that.
Yep, that's fine.
So there are, so yes, there are the age differences, the 16 and the 18, and that's just because of how the studies were conducted. And each of the clinical trials for each of the vaccine manufacturers, they kind of basically only gave, or they only enrolled people that were 16 and up for Pfizer and 18 and up from Moderna. So that's why those age differences are there.
And also just like Dr. Agu was saying, so it all depends on who was enrolled in the trial. Right now, we know that Pfizer, they have some data, you know, with patients that were 12 to 17. And when you looked at immunization advisory boards, they allowed 16 and up. Moderna did not at the time have the younger children. So right now there are clinical trials that are trying to enroll children. We know younger children, but that's mainly why we have the age differences.
Got it. There's also a question in regards to some of the post-vaccine reactions. And if we can answer the question of one, what are the common post-vaccine reactions? And then two, what are the reactions that someone can have that would require them not to get the second dose of the vaccine?
So I'll start with, well, basically I am now 30 hours post my first dose of the Pfizer vaccine. Only side effect that I experienced was injection site pain. They give the injection right on your shoulder. The common side effects of the vaccine are injection site pain, headache, mild fever, myalgia, and you could get some muscle aches. But remember, these are common, these are expected with most all vaccines. This is your immune system building up the antibodies to the spike protein. So, I mean, there are side effects, but they're expected.
Just to add to what Dr. McFarland is saying, there's also questions in the Q&A. So we're getting questions from both your chats and we're also getting questions in your Q&A. So if you guys just bear with us, we're gonna work our way to getting through all these questions. So there's a question in the Q&A that's saying, if a patient has a reaction to the flu shots, vomiting, constipation, fever, should they still get a COVID shot? And how can we see the ingredients that might be causing these reactions? Those are a question that's in the Q&A right now. So we're getting two sets of questions. So if you guys,
and if everyone can actually use just the Q&A, that is what
exactly.
Yeah.
Perfect. Yeah. If everyone could just use Q&A and not post in the chat, that would be helpful to us. So that way we can make sure we keep an orderly fashion in terms of answering your questions. For me, I've gotten both vaccines, both dose 1 and dose 2. I would say that during the first dose, I felt a little ill, which is expected. When we're saying that we're getting vaccinated, we're saying that we want to mount a response to it. So that means we want to mount an immunity, some sort of immune response. So to say that we didn't experience anything at all means that we got to figure out why is that not happening? And it's actually our body's reaction to saying there is something foreign in us, let's respond to it. And that is the positive thing that we want to see happen. For the second dose, I didn't experience anything at all. I think the first one was when I felt like a little ill, maybe a headache, but nothing beyond that.
Okay.
Yeah. Also,
yes, please go ahead.
Yeah, I also got the vaccine. I'm like about 2 weeks out from getting the second dose. I experienced, after the first dose, I didn't experience any of the expected reactions. However, after the second dose, I did have injection site pain, a little bit of a muscle ache on the injection site. I also had about a headache and a fever, as well as body aches for about 24 hours. That did resolve. And like we said, all of these are expected reactions, which is different from side effects. So we want to make that distinction. Side effects, are totally different from what an expected reaction, which is what we want our body to do when we have these vaccines. It shows that our body is mounting an immune response.
Okay. We have another question. And just since that question specifically was asking about if you take the flu vaccine and you get vomiting or you get constipation or you get fever, whether or not that should be an alarm to you to not take the COVID vaccine. And as a panel, we've discussed this, of course, prior to, just to give you the specific answer for that is the answer is that those are not contraindications for you to get the COVID-19 vaccine. If you've had reactions to the flu vaccine, there are different ingredients in those. You asked about how you can look up the different ingredients. One, it's definitely widely available what's in there, but a lot of it is just nanoparticles. There's no egg, as in the flu vaccine, which some people have been allergic to in the past. So these are different ingredients. It's actually one of the purest vaccines that have been created, in the sense that we're not using a whole lot of other derivatives. As a result, you are not able, you are able to get the COVID vaccine, even if you have had fever to the flu vaccine. Certainly that's also one of the expected reactions to any vaccine that you're getting. The next question is, we have, what's the elevator speech to convince family and friends who are skeptical, for instance, believing in conspiracy theories like a microchip? So in elevator speech, guys, it looks like somebody's trying to come up with a 1 to 2 minute, actually probably a 1 minute response to tell their friends and family what's the importance of getting the COVID-19 vaccine. Can anyone take that and really take the challenge of answering that question in 30 seconds? To 1 minute?
I would say that one, period, there is no microchip in the vaccine or immunization, okay? The government is not tracking you with a microchip. The purpose of vaccines, any vaccine, whether it was COVID-19 or our routine vaccinations as pediatricians, is really to protect you. So I think of it really as a seatbelt. You know, when we are driving, we wear our seatbelts to make sure that we stay safe and that we don't injure ourselves if we get into a crash, but it doesn't mean that you won't get into a crash. So I say all that because the purpose of the vaccine is to prevent like disease and the severity of the complications that come with those diseases. So that's why it's important to get it. But the government is not tracking you with a microchip.
Good. And I think from our discussions before as a group, you know, one of the biggest things we want people to know in a quick elevator speech is, one, what there's a lot of unknowns here, but what we do know is that COVID-19 has been one of the deadliest viruses that we have seen, and it is killing people. That's one. Two, the vaccine has had research behind it for over 30 years. And in particular, this is the first time it's been used specifically as an mRNA vaccine, but this research is been here. It's not something that just got developed in the last 1 year. And that's the reason partly why they were able to rapidly develop this vaccine, in addition to lots of finances, and in addition to the fact that there were so many people affected by this that they had numerous volunteers. And thirdly, they have been able to do the trials together versus sequentially. So there's a lot of reasons for that. So those are the things that we do know. This is a deadly virus. If we do not curb this, many more people will die, including in our community. So
and I think the last thing too to mention is that it's disproportionately killing people of color. So I mean, I think that's probably the most important thing to remember as well.
Yeah, I just wanted to add on to what you were saying, was just that the way that I think about it and explain it even to my patients is that it's like a risk versus the benefits type of option here. So you have the vaccine, which has the technology has been researched for several years, just like what Dr. Allen said. Then you have COVID, which basically has not been researched for many years. And so we look at the risk of getting COVID and the side effects of getting COVID, which can be range anywhere from asymptomatic to people that die, people that have recovered that are still currently having symptoms, or people that recovered and kind of slipped back into a worse state. All those things occur with COVID. With the vaccine, it's been heavily studied. The reactions that have been seen so far are, like we've all said, the expected reactions with the fever, the chills, and things like that. Of note, when I went through the vaccine research myself, no one died, particularly attributed directly to the COVID vaccines at all. So you look at that versus the deaths of COVID currently, which are currently over 400,000 now. So that's the way that I think about it. So if I had to choose ultimately which one would I go for and shoot my shot for, it would be the COVID vaccine, because that's what I feel the most safe in. That's has been researched and data will support that. So
I could interject just really quickly, just to get us a little bit more organized in terms of answering everyone's questions, because we do see 41 questions in the Q&A, and then we have some in the chat. I would ask everyone to direct their questions to our Q&A, just so that way we can keep in an orderly fashion as the questions come. If you like the questions that you see already, you can like that question, and we can make sure that that one is definitely addressed. Like the first question that I see right now has 4 people that have agreed to wanting to see that question be answered. Just to keep us a little bit more organized, because it's a little challenging to see both the chat and the QA questions for us, and as well as for our moderator, who's doing an awesome job.
So with that said, we are going to have the next question. And what we will do is, since we have so many questions to cover, we'll go ahead and keep all of our answers to about 30 seconds and less. The next question that we have is, does this vaccine affect fertility? That's been a rumor that's been out there.
I can answer that.
Wonderful.
According to the studies that we have availability to, there's no effect on infertility, and it should not be a hindrance if you're planning on, conceiving or having a child. So just, I would just still recommend getting the vaccine if you're considering it.
All right. And we will be able to provide other details even after this evening session. So if you have further questions about your resources, we will plan on sending those out. Our next question is, according to the USA Today, the country's history, including the history of public health, is tainted, certainly with racist policies as well as practices. Black folks are skeptical, yes, and suspicious for many reasons. Our health system has consistently fallen short of serving us in the same manner as our non-Black counterparts. What advice can you give African Americans that have distrust in the healthcare system? So there are many of us, I mean, we are all a part of the African American community, and we fully understand that ever since 1600s, even unto now, that our communities have been neglected and that we have health disparities, that events like this that's our whole passion and our whole intent. It is to be able to put the trust and be able to let you know that we are here and we are in this community, and that we are filtering things for you, being able to go directly to the research for ourselves. So many times, as we've been preparing for this, we went through the research of how many African Americans were included in each of the trials. Both Moderna and Pfizer had 3,000 African Americans who received between the two, who received the vaccine and who were able to have efficacy, the 95% that is reported as well. I mean, we can go on and on, but the bottom line is that is exactly what we are here for. And this is exactly what this event is. There are, the National Medical Association is a society of Black physicians, and we are out here thinking and acknowledging and trying to rectify so many of the health disparities that we have already seen. With that said, I will move on to the next one. If I have COVID, why is it necessary to get the vaccine? And Dr. Williams, would you like to answer that, as well as Dr. Okoye?
Yeah, sure. So the reason why is that in patients who've had COVID-19, it has been shown that after about 3 months, most of the patients had lost their antibodies, and also that with the immune response after having natural infection is variable. So with that, after 3 months, we've seen reinfection after you've been infected with COVID-19. So, and the vaccine has shown to be much more robust as far as an immune response and durability. So therefore, the vaccine seems to be better than as far as providing immunity in comparison to having the natural infection.
Absolutely. Dr. Okoye, did you want to add on to that quickly?
Just very quickly, exactly as it was mentioned, what we know from studies, the vaccine tends to have a little bit much more of a robust response or a reaction. And we're right now seeing that there may be some signs of better longevity. Why still, again, if you if that's there, if you still have doubts. If you do get COVID, if you have the disease, yes, you may have some level of protection. We don't know for how long. The issue is that the actual area of the virus that your body has fought against, it may not be, an area that may be the best location. So for example, very quickly, if you, let's say your body build up a response and that was to a hand on the virus, just to make it very basic. If you have a virus hand-drawn figure, the body's response, what they do to is they attack pieces or areas of a specific agent. You bring in the coronavirus, it attacks one spot, but it may not be effective if you should have exposure another time to COVID. There are signs or concerns for reinfection. And now that there's concerns for also variants, we want to make sure that the area that your body builds up an immune response will be consistent among different types of coronavirus variants. All right, so it's best that we do the vaccine, because the vaccine itself, we know it traps a very specific part that neutralizes, that means keeps the virus from infecting the body. All right, but also it has to have a level of protection against future types of coronavirus.
Absolutely. And that leads us right into our next question. And it says, as the virus mutates, are we confident of the effectiveness of the shot? And is work ongoing on the mutations? Dr.
Yorota, go ahead.
Yeah. So for the way the vaccine works,
we kind of missed Yorota. We can't hear you.
Dr. Yorota?
Kind of broke up.
Okay, Dr. Yorota is, as her Wi-Fi is coming back through, we're gonna let Dr. Williams take that question.
Come on, Xfinity.
Yes. Yes. So we know that the Pfizer, they looked at the, in particular, the UK and the South African variants, and it shown, the Pfizer vaccine has shown to protect against the variants that's been found in the UK and also in South Africa. But more importantly, I think that it shows the urgency in trying to have the population immunized, because the natural evolution of viruses in nature is for them to mutate to try to survive. They want to try to survive, and so as they continue to mutate, there is a concern that these mutated variants may become the dominant strains that will circulate throughout the population, and therefore there's an urgency to try to get as many, try to get the population immunized to try to combat this from happening. So, but I would say at this time of the UK and South African variants, there has been studies done with the Pfizer vaccine that's shown that it has protection against those too.
So bottom line, you need to get vaccinated. That's what he's saying.
Yes, everybody, as quickly as possible. So let's move on to the next one. If you have the antibody, should you still get the vaccine? That question we've answered. And we talked about the antibodies lasting for roughly 3 months is what studies have shown. This question is directly to Dr. Evans. It says, which vaccine did you receive? And then it opens up to everyone. It says, can everyone state which vaccine they received when they vaccine? So let's go ahead and say, I'll just say, Dr. Evans, I'll let you take this first, and then we can all go around who've already gotten our vaccines. Go ahead.
So I received the Pfizer vaccine.
I too received the Pfizer vaccine.
I got Pfizer.
Yep. We both got the Moderna.
I got Pfizer.
I got Moderna.
I received Pfizer.
I'm signed up to get Pfizer.
I have not gotten the vaccine yet.
Yeah.
That's something that as healthcare workers we're experiencing a little bit. If you're not affiliated, one, you have to understand, like, there's different tiers of who's getting the vaccine first. And as an outpatient pediatrician, even though I'm on the front lines, I'm not in the emergency room, in the hospital. So that's also why I have not gotten it yet. So I have signed up to get the vaccine, and we'll be getting it this week.
Absolutely. And with that said, our next question, if we are able to quickly give a response, It says, you know, can we again clarify the difference between side effects and an allergic reaction in regards to the reasons for the vaccine? If we can just quickly say that in about 30 seconds. Yes, go ahead, Dr. Evans.
Okay, so basically when I'm saying a reaction to the vaccine, that means at the side of my arm, I'll have a little bit of pain. I'm expected to maybe get a fever. I'm expected to get maybe some sense of fatigue and tiredness. This is my body saying there is something foreign and I want to mount a response to that so I can develop a, oh my gosh, my mind just went blank. But basically I want to mount a response that I will be able to hold on to for future. So that way, if at one point I run into someone with COVID, I may not actually get COVID. Okay, when I'm saying a reaction, that means that I am literally breaking out in hives. I'm breaking out in hives. I am maybe requiring intubation because my airways have been clogged. That is a anaphylactic, what we call anaphylactic reaction, where your entire system just shuts down because of the response to this. But those are adverse events. And based on what is in the CDC's guidelines at this time, anyone that has ever had an experience where they're actually having an allergic reaction where I mean, for the simplicity of it being hives, or you're literally just, your body just completely shutting down. If you've ever had that experience with any vaccine, they're saying not to be vaccinated. But for everyone else, you can get a vaccine in the hopes that your body is mounting a immune response that creates lasting memory.
Just to clarify, yeah, what Dr. Evans is saying is that the CDC, there's difference between contraindications and precautions, okay? So a contraindication is if you are allergic to the ingredients of the vaccine, which I know we're going to get to, it's a question and that's up. If you have had a severe allergic reaction, like anaphylaxis, like Dr. Evans said, that is a contraindication to those ingredients, that is a contraindication. A precaution is if you have had an allergic reaction to vaccines in the past or to any injectable medication, right? That you should be monitored after you get the vaccine, which is why they're requiring people to sit for 15 to 30 minutes after the vaccine. So just to clarify.
And specifically, most people get monitored only for 15 minutes. Whenever you go to get your vaccine, you will let them know that, hey, I have had some allergies to things before, injections before. And they will let them know that you would like to be monitored for 30 minutes instead of the regular 15, okay? I believe someone actually asked, should they bring their EpiPen? All of the health facilities, first of all, if you have an EpiPen, you should always have it, just so you know.
Amen.
And second off, all of the facilities that are giving out the vaccines have qualified nursing, and they also have their own Epi supply. So there doesn't need to be a fear. If you've forgotten your EpiPen that day, they definitely have your back. That is an expected reaction, not just with these vaccines, or, you know, it's an expected reaction for many of our infused medications. So this is something that the healthcare facilities already know about. And the healthcare community knows about. The next question that we have—
Dr. Allen, I'm sorry, I didn't mean to cut you off, but there has been a pleasant older lady, I shouldn't call her older lady, but there has been a pleasant Miss Martin that has been raising her hand since the start of this, that wants to actually ask a question. So I'm gonna allow her to ask a question if that's okay.
Okay.
Okay, we're gonna
mute myself. I didn't know that my hand was still raised, first of all, but I've got to give a shout out to Dr. Randall McPherson from my hometown in Kalamazoo, Michigan, which is next door to Pfizer, Portage, Michigan. But my question was, and I heard earlier, was that we know in Kalamazoo, not in Kalamazoo, we know that in Oakland County, I heard one of the physicians say that Oakland County is number 8. And I'm assuming you're talking about the state of Michigan as far as the number of individuals with this COVID. So my question is, with Oakland County being number 8, do we know where that concentration of individuals is coming from in Oakland County? Do we have any idea?
So it's not Oakland County, it's Wayne County.
Wayne
County. Wayne County is, in terms of the number of deaths across the US, Wayne County is currently number 8.
Okay, it's Wayne County, and that's the United States. Okay, I wanted to make sure about that.
Right now, Los Angeles is number 1, and we are number 8.
Okay.
All right. Thank you so much, Ms. Martin, for that question.
Yeah.
And for the shout out. We have another question in regards to underlying illnesses like diabetes, high blood pressure. Is there other risk in getting COVID vaccine if you're over 60? Just to clarify, let me put this question in perspective to the panel. So it sounds like altogether, this particular person is asking if they have diabetes or high blood pressure, as well as are over the age of 60, let's talk quickly about what are their risks of getting COVID?
This question. So these are all cardiovascular events, and there is very strong data that is saying that if you have a history of cardiovascular events, there's a very high likelihood that you're going to get severe symptoms of COVID. So it's imperative that you strongly consider getting the vaccine to protect yourself from getting these severe symptoms. So those all go under that heading of risk factors. COVID naturally, that you would not fare very well, and this vaccine could protect you.
Exactly.
Also wanted to think about other high risk medical conditions would be like pregnancy or cancer, chronic kidney disease, obesity, if you had a BMI greater than 40, sickle cell disease, smoking, because you have a higher risk of getting COVID-19, that is another reason why these groups are it's recommended that you get vaccinated, if you have these high risk conditions.
And speaking of that, there's another question just to bounce off that says, my concern is the vaccine for people in high risk categories. And this participant says that from what it sounds like from what they've read, or maybe from the information that they've received, they're asking, is it true that there were no trials done with people who have high risk? And what are high risk? So we've already covered what the high risk are. Thank you so much, Dr. Ikwezuma. But let's talk about the fact that the trials, who were in the trials? And let's try to clarify this question for this participant. And Dr. Williams, since you were one of the PIs for the Moderna vaccine, I'd love for you to be able to answer the fact that, what types of medical conditions did people have who were in the trials?
So the trials, the people that were in the trials were very reflective of the population. So, there were people with diabetes, hypertension, cardiovascular disease, chronic kidney disease. There were people who had HIV that was stable, that was in the trial. Patients with autoimmune disease were also in the trials. So it was a very diverse population that was representative of the general public. So in actuality, those patients were the patients who kind of made up the trial, were those patients who had high risk, who had risk factors for severe disease. So I would actually say that they were studied, and they were the people who made up a good portion of the trial.
And this is exactly why we're doing this, right? Because there's been so many different things that are out there, but again, we've been able to look exactly at.
Let me just piggyback off. So,
yeah.
The Moderna trial had 30,000, the Pfizer trial had 43,000, and, which is a lot of people. Ordinarily, most vaccine trials have nowhere near this amount of people in the clinical trials. They may have hundreds at most, but to have, thousands, 30,000, 43,000, it's kind of extraordinary to say the least. So I know people have had some, concerns about, whether, these trials were reflective of the general population. And as you alluded to earlier, Dr. Allen, that there were like 9% in the Moderna trial were African American, which is close to what our, population is in the U.S. So I would say that the trials were pretty reflective of the general population.
Good. All right, so we have a couple questions. It sounds like we have someone who is actually asking about the question about What about a person who is predisposed to blood clots? Is it a contraindication? That's a quick yes or no, guys. Anyone can take that one?
No.
Okay. Then it says, how about let's touch on pregnancy and whether or not pregnancy is one, a contraindication for the vaccine. And if someone is pregnant, have pregnant people been taking it, guys? Can we answer that for them?
Oh, absolutely. So according to the American College of Obstetrics and Gynecology, again, pregnant women are, we say since pregnancy is a potentially higher risk state, we recommend that pregnant women at any point during their process, whether preconception or during their pregnancy, they go ahead and get the vaccine, particularly for the reasons that Dr. Lee Allen commented on before. For example, pregnant women are they can get hypertensive diseases like preeclampsia, eclampsia. They can also get diabetes of pregnancy. So for those reasons, we recommend going and proceeding and getting the vaccine.
Okay, wonderful. We have another quick no answer. It says, can this vaccine cause autoimmune disease? Certainly you can give a yes or no and also let the folks know what the research shows.
To answer that question, no. And there were patients, as I stated earlier, there were autoimmune disease patients in the trials. And in comparison, looking at the patients who received the vaccine and the placebo, there was no difference. There was no autoimmune disease flares. And currently to date, there is no evidence to suggest that the vaccine will cause.
Wonderful. Thank you so much. And Dr. Poirier, I know that you want to answer.
Just an extension.
Go ahead.
Everything was good. Just because some of the questions refer to that same, I just want to make sure people are aware, as when we're talking about autoimmune disease, this is including MS, this is including rheumatoid arthritis. And so some people may know about this. So there is no indication that you should not get the disease. You should not get the vaccination because you are at higher risk with the disease out there. So we do recommend that you get it and do speak with your primary care doctor so let you know about any other specific details.
Wonderful. And then this is actually a good quick yes and no. If you receive one vaccine, is it necessary to get the same the second time?
Right now, that is something that Dr. Fauci and other top officials have debunked, that you cannot get one or the other. You have to stick with Pfizer for the first dose and Pfizer for the second dose. There are studies that are looking at that in the UK because they're basically right now strained for supply. So they're considering alternative options if that is something that's okay. But as of right now in the US, that is not something that we're doing. You have to stick with the same company and type.
And then along those lines, it says, how long is one protected after the second dose? Go ahead, Dr. Okoye or Dr. Hagstrom.
Yeah, so what I wanted to say from what I've found is that, we don't have a, 100%, answer as far as, what specific length of time. So that's kind of ongoing. And as more people get vaccinated, we'll kind of find out down the line exactly, what is the best length of time that we can expect, you to maintain the antibodies. But at this time, we don't have a really good answer as far as what the expected titer is per se.
Wonderful. Then we have another question. This also kind of speaks to some of the rare side effects. So not an intended effect, but a side effect. If you develop Bell's palsy after taking the flu shot twice and have other underlying immune diagnoses that require you to be on steroids, do you recommend a person taking it?
So in regards to Bell's palsy,
yes,
was noted to have side effect in 7 participants in the clinical trials. That was combining both Pfizer and Moderna. So that was 7 participants total out of all the thousands of participants. And when they looked at the percentages in comparison to how often Bell's palsy occurs in the general population, there was no difference. It's also important to note about Bell's palsy is that it typically resolves on its own or is very effective with steroid treatment. So that's still not a contraindication to receiving the vaccine.
Okay, thank you so much, Dr. Hirota. It looks like, sticking with this, will this vaccine have a negative effect on people with serious heart arrhythmias and sarcoidosis of the heart? And Dr. Hirota, if you want to just kind of answer that as well, feel free.
So as far as my understanding of anything, you know, if you have a cardiac arrhythmia, again, all those high-risk cardiovascular history, it's still something that you need to weigh the pros and cons against getting COVID naturally and receiving the vaccine to protect yourself. So those things is weighing, you know, one is better than the other. Everything is, again, going to be individualized for that person, but I think that it's really something to hit home about. You have to consider if you get this virus naturally and you have those types of conditions, the significant health risks that could occur.
Yes.
I would definitely just add, excuse me, to what Dr. Hirota just said. I kind of want people to understand that someone that has a arrhythmia, if they got COVID, it is very dangerous for them. It's very dangerous. Those are our complicated patients, unfortunately, that we have seen during this pandemic. I can speak for myself personally, patients with a background that are having any cardiovascular history having significant impact by the actual virus itself.
All right. And the next one says, it's starting to look like it's going to be another annual vaccine requirement, like the influenza vaccine. Is this so? Dr. Okoye, feel free.
Yeah, do we need to take this periodically? Well, right now we don't know. It's early. This is going to be based on a couple of things, and I'll just tell you what some of those factors are. Immunity, okay? We need to know how long after getting the vaccine will the immune response last, meaning that if you should be re-exposed, will you still have that same level of protection? Right now, we don't know that for certain. Some studies are projecting we have close to a year's worth of time. Nothing is definitive. But then that's the thing, if we only have a year's worth of protection, that may raise the idea that we potentially have to re-up on the vaccination to get another level of protection that next year. So that's immunity. That's one factor. The other factor is going to be the variants that are around. Of the variants that we know about, there's some signs showing that we have a good response of the vaccine is showing some protection to the variants that are there. But with future variants, we don't know if those type of different appearances of coronavirus, how they look now, how they may change, will the actual vaccine still hold the same level of protection? We don't know what the future of and what variants might come about, so we can't say definitively. If that should arise down the road, we may need to update the vaccine to cover for the new variant. And it's done very quickly. This is the benefit of this type of mRNA technology. Any updates that can happen can be done within weeks. So this is going to be, it is revolutionary. I'll just say that part. Now, all that in context, we don't know how long this is going to last, should we just not get the vaccine altogether and just go with the natural immunity? Absolutely not. We should still go and get the vaccine, even though we don't know the immunity, because we know that we get a significant amount of protection and better than natural immunity. And we know that with the vaccine, even though we can have to get it another time periodically, even though we know we have to get it annually, we're used to that process. We do this annually with the flu vaccine. So this is nothing that I personally am concerned about. And then lastly, the infrastructure as we move further through this period, and if we should have to repeat this thing, we realize that we'll have more information. the vaccine production and distribution infrastructure will be more refined, okay, and it'll be more reinforced. And that will mean for not just efficient vaccination, but safer vaccination. So as we go forward, this should come, I think it's still a good thing to go and follow through with.
All right. With that said, we will answer a couple more of the ones that we can answer quickly, and then we'll have another detailed one. Let's see. It says, can you clarify the difference between efficacy and immunity? And Dr. Williams, so that's a little detailed, but if we can answer that in less than 30 seconds, I think that will work.
Yeah. So immunities mean, do you, after receiving the vaccine, do you make antibodies? Can we detect antibodies for the spike protein in your blood? Efficacy means, does that prevent you from developing disease if you get exposed to the coronavirus? So basically what efficacy means is that after the second dose, those people who went out into the world and who got exposed to the coronavirus, they did not develop severe disease. So that's what it means by that it was efficacious or effective, meaning that it prevented them from developing disease when they saw the real virus.
All right. Various vaccines, which would you all recommend for people of color, particularly Black men? And I think in general, based on this entire panel, both the males as well as the females, we would recommend for people of color, males and females, to get either of the vaccines. Again, both of the trials had roughly 3,000 African Americans who did participate both in Moderna as well as in Pfizer's trial. Our next one, it says, I'm in my 50s and I've never had a flu shot. Not sure what to expect regarding possible reaction to the vaccine. Any insight? I think that question we've actually gotten a chance to answer pretty well as far as
reactions. And just to briefly mention that the flu vaccine is very different from the COVID vaccine. We're using mRNA technology for the COVID vaccine. So you can't really compare what your reactions or expected reactions would be because you have flu virus, that's a live attenuated vaccine, and this is mRNA technology. So they're just different.
All right. Thank you, Dr. Yoda. And then getting into, here's one other question specifically. This question says, the fact that the medical community, I actually think we've already answered that one. Let me just see. Nope. So the fact that the medical community stopped addressing nationally recognized public health issue, of course, being racism against Blacks, African Americans, descendants of enslaved Africans. And there is nothing presently or historically to warrant trust in America or healthcare system. Do you think that's affecting Black participation, and why there's a big push to put Black faces to recruit Blacks? And this is coming from one of our strongest advocates and supporters for one of the Detroit Reach Out to Youth programs, Dr. Tynes. Thank you for your question, Dr. Tynes, and thank you for tuning in. So any one of us can take on that. I think he's just trying to make sure that we offer our input on this particular most important issue.
Well, I think we should definitely acknowledge that historically the health community hasn't always been an ally to the Black community in terms of, when you think about Tuskegee or with the non-treatment of syphilis and some of the other things that have happened. Yeah. Or Henrietta Lacks, with the studies that went on in that situation, or if you think about J. Marion Sims and all of the treatment of fistulas and not giving anesthesia to pregnant mothers. I think when you think along those lines of things, I think historically there hasn't been that it doesn't go beyond the pale for us, as African Americans to trust the medical community. But I think from our perspective, as Dr. Lee Allen mentioned, our goal is to make sure that our community isn't missing out on the opportunity to get vaccinations. And having seen COVID-19 affect our communities up close, and seeing people that we have worked with succumb to the disease, our goal is it's just to make sure that we educate, and then also to make sure that the people that look like us have every chance to get the vaccination if they can.
Absolutely.
I also wanted to just briefly or quickly answer that. Again, as a pediatrician, I answer everyday questions about routine vaccinations. So I always say with my families, the key is to be transparent and to be very clear. So in the case of COVID-19, it's very important that we give coordinated, clear, consistent information that's based off of the science and data. That's why I tell my parents. You know, as data presents itself and as the science presents itself, we are also going to give you that information. So my goal always as a primary care physician is to make sure that you are well informed so that you can make the right decision.
Absolutely. And everyone, I just want to let you guys know that as we are answering questions through our panelists, we are also typing answers to questions. And so rest assured, thank you so much for sending in your questions. Don't stop. Even if we are towards the end of the program, we are still available on all of our social media sites. And we will also be sending out information, as I said a little bit earlier, on questions that may not have gotten answered, or just additional resources to questions that we may have given answers to already, okay? Just so everyone knows. And then I have a question, which is pretty much something that is being asked. If I've gotten my first shot, this person in particular says AstraZeneca is the vaccine that they got. How important is it for me to get my second shot? All right, we'll have Dr. Jermaine Hostrom answer this question.
So in general, looking at these shots, the reason why that there is two is because, for example, with many of these vaccines, after the first dose, it is often only shown to be roughly 50 to 60% effective. After the second dose, that's when you start to jump up into the really 70, 80, 95%, the 95% that we've been hearing about, and plus range of effectivity, which means that out of the participants that were there and the different studies, 95% of them after that second dose got a high enough antibody count to where they can be considered safe, to prevent from developing severe symptoms, essentially. Now, a question that I often get is, if I do get the vaccine, if I have this 95% efficacy, can I still get COVID? And so the answer to that would be, you can still contract it per se. You may not be symptomatic. And so one of the biggest things that they're looking at is the transmissibility. So even though you get the vaccine, you could still essentially have COVID within you at some points, but we don't know yet if you can still transmit it to somebody else yet. But the biggest benefit at the moment is that the efficacy showing that, right now you will be not developing severe symptoms from COVID, which is the goal at the moment. So.
All right. We also have a question in regards to long-term effects of COVID, and whether or not the long-term effects of COVID is something that insurance companies should raise a red flag and not want to cover patients. And can we speak to that, and maybe even opine on whether what our stance is from the medical community?
That's a really great question. I mean, really great question. I can't speak to the insurance companies and what they will do, but I think that this pandemic is long lasting. It's not something that will just last 2021. I do believe that we will see this 2022 and have plans moving forward, and we will develop more, getting better and better at what we do. There are currently patients that have been affected with COVID that are starting to develop some unusual late phase, I would say, symptomatology, be it things such as like chronic disease syndromes, chronic pain, not being able to, having these fuzzy sensations in terms of their mental capacity. So unusual symptoms that our being tracked and monitored as we speak. Those studies are technically undergoing. So we can't speak so much to them, but we are seeing patients that are having symptoms that are concerning for what's considered a chronic COVID type of presentation.
You know, I also see, you know, along with chronic COVID and whether or not insurance companies should provide or protect, you know, the bottom line is disease. And there, you know, there are many things that warrant for people to be able to be insured, not only by health insurance, but also by life insurance. And that's just about justice, particularly for everyone deserves health coverage. Everyone deserves the ability to make sure that if they are able and willing to pay for life insurance, that their family members are protected afterwards. So, you know, as a medical community, the thought definitely is this is a disease, and it's something that, you know, the sequelae of it or the impacts that are late effect should not preclude people from getting their what anyone else would be able to get, particularly being that it's affected, again, in the US, 92 million people, over 92 million people. So the insurance companies will be losing a lot of people if they decide that they do not want to take care of people with COVID and late effects.
And I'll just throw in, and then
Dr. Okoye.
Yeah, some assurance. The previous administration, as well as the incoming administration, has already made it mandatory, basically stated that patients should not be paying for anything related to this pandemic. In terms of the vaccination, the Operation Warp Speed, soon to be renamed and then restructured. The ideas of how we can, it's going to persist and is going to continue to support. So those costs should be covered under the government. So the private insurances are still in an agreement or a contract with the government to not have an individual pay out of pocket. So that's just some assurance for you guys.
All right. Let's also answer the question of, is there concern that over quarantining to mitigate the risk of COVID exposure can make a person more susceptible to other serious illness? So if we want to answer that pretty quickly.
Yeah,
The question is quarantining a possibility for making severe illness possible?
Yeah, and they mean apart from COVID? Is that what they're, I guess what they mean?
Yeah, they're saying other illnesses, yeah.
So actually, yes, and I've seen this just last week in clinic myself, where there was a young guy that came in. He has, you know, a history of, you know, diabetes, hypertension. The biggest thing that really got me was he came in with a sugar of about 398, almost 400 in the clinic. So of course I addressed that, and I asked him, you know, why is it so high? And he you know, wanted to talk to me about, you know, he's been out of insulin, things like that. He's been afraid to go to the pharmacy to get this proper medications because of exposure. He's afraid to go to the hospital. And so, yeah, I have seen many cases apart from COVID itself where people do have the fear of going to the hospital or going to the clinic or going to the pharmacy because of that exposure, and then they end up in a worse outcome than they would have had they, you know, gone earlier. So what I say to that is, you know, there are precautions in place to those that have that fear of going out and getting the exposure. You know, clinics have proper precautions. Depending on your clinic, they don't allow people to sit in the waiting rooms. That people sitting in cars to wait. In the hospitals, they separate you know COVID patients from non-COVID. You know, they have different entire floors actually, and I found that to actually be really effective actually to keep people separated in that manner. So in that regard, you know, if you do have that fear, again, I will talk to your doctors that they can explain to you all the procedures that they have in place to mitigate that fear, just so that you don't end up in a worse state of health from your other health conditions. So.
Absolutely. I just want to get to a question I think that we have seen and haven't really been able to touch on just yet. And that is, what do we do after we've gotten the vaccine? Do we still need to wear masks, wash our hands, and watch our distance from people? Who would like to speak to that?
Say absolutely.
Go ahead, Dr. Pearson.
Okay. Dr. McPherson, I tell you what, how about you get it 20 seconds and then we'll give Dr. 20 seconds. Go ahead.
I would say absolutely 100%. You have to continue to, doing keeping yourself distant, keeping small groups, wearing your mask, washing your hands. As it was stated earlier, we don't 100% know, how long immunity lasts and the long-term effects. So just because you get the vaccine, yes, it's 95% efficacious in preventing severe COVID-19 disease, but there's possibility you still can contract the virus and pass it on to friends, family, or loved ones. So until then, get the vaccine and still wear a mask, still social distance, and still, try to keep your bubble small. I use the term, keep your bubble small.
Yeah, this isn't just about protecting yourself, it's about protecting others. If you're carrying COVID and, you're touching your family member's face, hand, hugging them, if you're not practicing those social distance measures, washing your hands, keeping your mask on, you're potentially affecting their health too.
Absolutely. And then I also have a specific question on breastfeeding and receiving the COVID vaccine, if we can touch on that.
Yeah, so according to ACOG, or American College of Obstetrics and Gynecology, lactating mothers or breastfeeding mothers, it is still completely okay to, as far as get the vaccine and breastfeed. We recommend just along with I think I'll let some of our pediatrician colleagues answer the other part of that, which is about from the child side.
Yeah, so getting the COVID vaccine and breastfeeding is okay. And actually, moms who are found to be COVID positive, they still can breastfeed their babies as well. In the neonatology world, we do recommend, though, that moms are wearing masks. We recommend that they are washing hands, and we recommend that they try to maintain the safety precautions when it comes to breastfeeding baby. So we do recommend breastfeeding baby.
Mm-hmm. Okay, and it's I have another question in regards to whether or not the mRNA will duplicate a person's DNA. And if maybe Dr. Williams, if you can take that and just kind of answer pretty quickly on that note.
The answer is no to that. So the mRNA is on the outside of the nucleus. The nucleus in our cell is where our DNA is housed. And after the mRNA is taken up by our cell and is used to make the spike protein, it is quickly degraded. So it has no chance to go back into the nucleus or has the ability to interact with our DNA.
All right.
So and then think of it, the mRNA as like Snapchat. Once it enters the cells, it gets translated to start making proteins, and then the actual mRNA disappears. I would say also think of it as an IKEA booklet. You read the instructions and then you're gonna throw the booklet away after 3 minutes. But that's the same thing with the mRNA vaccine.
I like that. That is awesome.
Yeah. Exactly. And then I have a question. I think we've talked a little bit about this, but maybe if we can just give the percent, and I can take this one really quick. So basically it just says, can you talk about the percentage of severe side effects and how they relate to normal incidence of the side effects? And I think Dr. Urota spoke to that in regards to Bell's palsy. As much as it was seen in the trials is also as much as it was seen without any trials in general population. That is the same thing in regards to the anaphylaxis. Actually in the trials, anaphylaxis was not seen, but there was a general risk of less than 1% or 1 to 1.5%. So it is true, anaphylaxis is not something that is commonly seen. This is very, very much of a very low incidence. And I see Dr. Hagstrom, if you want to answer that, because we're going to get ready to get started to do our poll as Dr. Hagstrom answers this question.
Yeah, so just in regards to the Bell's palsy, so what they found essentially was, So in the general population, Bell's palsy occurs might be about 25 to 35 people per 100,000. What they found in the studies was that per 40,000, it was way less than that. I believe it was only about 4 people out of the 40,000 participants, which is that percentage is far less than even the population itself. So that goes again to show that that's why they can't at all contribute the vaccine at all to the severe side effect of Bell's palsy. So.
Absolutely.
Yeah, Alan, I really want to touch on the most severe side effect we're concerned about out of them all, and that's death. There's plenty of articles out here that are, connecting deaths and the Pfizer vaccine, in particular, the OBGYN in Florida that passed away 16 days after getting the vaccine. Currently, that is under investigation. It's not completely clear if that is related. Pfizer actually has already made public statements stating that it is not. There's really strong data still supporting the safety of the vaccine. When you look at how many people have gotten this vaccine, 11 million as of this week in the US, and only 1 possibly associated death. That's some positive things, despite that being a very unfortunate event that happened to him, because I heard he's a strong advocate of this vaccine. So it was very sad to hear about the loss of this physician. However, when we're looking at just from a statistical standpoint, that's some pretty strong data. In the clinical trials, even there was only 1 reported death, and that one was found to receive the placebo. So it was not anyone who actually got the vaccine that has passed away in the clinical trials. That was just, that was related to just someone who got a saline shot. There's also most recently in Norway, there was the reported 33 deaths that were associated with the vaccine. And when they reviewed, again, that's under more investigation, but when they did review everything, the public officials in Norway are still strongly advocating for getting the vaccine. They looked at those who had passed away, and they were noted to be very fragile patients. These were patients that were in nursing home with life expectancy of only a few weeks to months at best, that without even getting anything that could potentially trigger their health, they were expected to pass. So that's important to note that, again, stronger and stronger data is still supporting getting the vaccine.
Absolutely.
And one more thing, Dr. Allen. I know this.
Sure, I believe Dr. Evans is getting ready to pull up our poll. A few more minutes.
A common question is the ingredients.
Yes.
What's in the vaccine? I know you briefly mentioned earlier the lipid nanoparticles, which, lipids is just a medical term for fats. And in order to get the mRNA itself is very unstable. So in order to get it into the cell, they encompass it basically in fats. They also use salts and sugars to kind of use as a buffer to protect it. Now, there is a component it's called polyethylene glycol, I believe, PEG. It's the same component that's in Miralax, for people that know that's when you're constipated. And also for those who had their colonoscopies, the Go Lightly drink, it's the same component. So some studies are showing that they believe that is causing some of the, common adverse side effects. So if you ever had a side effect to taking the Go Lightly or Miralax, then they recommend, you speak with your primary care physician and, do a risk versus benefit on getting a vaccine. But those are the main components. It's just lipids, fat, salts, and sugars.
Good. All right, Dr. Evans, how are we doing with our poll?
Yeah, so I'm gonna present this poll. We're gonna do it 1 question at a time. Is how it will come up. Okay, everyone. So, actually, yeah. So once everyone starts, go ahead.
All right. So again, our first question is, overall, how would you rate this session? We are nearing our end, and we just want to make sure we are on the right track and doing good work here. And Kanisha, do we have any results yet?
So Janelle, actually, if you continue to read, they are all posted together. I thought they were separate, so you can read to the next question. My apologies.
Okay, and then okay, so our next question is, do you trust, or are you trusting the information that we've already presented? Our next question is, did you easily understand the information that we've been presenting?
You can go ahead and read the next one. Was it important that the information was presented by Black health experts? Question number 5, do you feel like your knowledge about COVID vaccine has increased from before the session to now? And then our last question is, did the session influence your decision about vaccination? This is a particularly unique question. We want to kind of capture whether or not you were already in the hopes of getting the vaccine and this is just supporting it, or it may have changed your opinion of being vaccinated, okay? So I'll share with everyone what the polls look like as of right now. I'll give people 30 more seconds to answer.
Yeah.
It looks like we have of the 250. This is I must say, this is amazing. I'm very grateful for everyone that has registered, volunteered to sit and listen in on a day like today. This speaks volumes about our community and our the necessity of wanting to know what to do next in terms of this vaccine. Right now we're at 173 out of 240 that have answered. So I'll still give
Wonderful. And we'll just give people just another 30 seconds because I want to just make sure that we're not jumping 2 questions so people don't have enough time to answer their questions that we've given to them. And then
absolutely, we're at 100 and yeah. So right now we're not at our max of people that are in attendance is 250, and only 183 have answered the questions. And we'd hope that everyone would take time to just answer the poll. That would
yeah. And as you guys are answering it, it looks like one of our attendees said, this is great. This is like a town hall. Can we do this quarterly? Just know this is not the last you've heard from us. We definitely intend to do not just COVID-19 vaccines and updates, but also, other issues that impact our community. Again, we are Black physicians. We grew up in our communities. We are all for our communities. We are dedicated and committed to you. And it is our job and our duty and our pleasure to be able to get information out to the community and to use social media platforms for the good and not for other things. But this is our thought. This is our intent. This is what we wanted to do tonight. So we really, really appreciate you. All right, Dr. Evans, let us know, how are we doing here?
We are at 196. We're at 96.
While we're waiting for people to answer our poll questions, me and Dr. Johnson kind of wanted to give more information on how COVID-19 affects the pediatric population and the virus. And the vaccine. And if it's
that's perfect. I just want to give the folks just a few more seconds so that they can have you can have their undivided attention. Okay. So that they don't miss anything and as they're trying to complete.
Okay. Should we add the Jeopardy music?
You putting some pressure on them, huh, Dr. Johnson?
This is what defines the pediatric.
I know. And
so we're at 200. If we could get 45 people to just answer the questions, we would be very happy. If we get 45 people.
We'll give another 15 seconds. How about that? 15 seconds.
Yeah, 5 minutes.
I don't know if I can hum that long.
If I can get 45 people that's on this Zoom session to answer our 6 poll questions with their eyes closed, that would be great. Okay.
How could they do it with the eyes closed?
I'm just saying how simple the question is. But we are really grateful. I am in all of the people that are here to ask questions. We were anticipating a gap between the questions that we have pre-registered questions and the questions that we are seeing. And the fact that there's still 73 questions here says a lot about your concerns for being vaccinated and this pandemic, which is
exactly. Exactly. And just again, I just want to emphasize, this is not the last of us that you'll hear from us. The questions that if we have not gotten the answer, gotten a chance to answer your question directly, we will be typing some things out, and we will also be able to send a resource and references that will have answers to the ones that we have. To the questions that we may not have been able to answer or type out a response in this 1 hour and a half. I also want to just reiterate, as Dr. Agu and Dr. Johnson, if you guys want to give your spiel for maybe, basically we're getting into last remarks. We have about 7 minutes. So if everybody can take like roughly 30 seconds, I think we'll be able to get everything in, and then we'll be able to give a final good night to everyone.
Okay, do you want to go first? You can go first. Okay, so the way I see the COVID-19 vaccine as a pediatrician is that it was a hope or a light in, you know, the midst of a lot of darkness, as we all understand, or we've all been going through this together. In terms of how it can help children, really, I mean, right now, of course, like we said earlier, children are not getting the vaccine under the age of 16. But the adults who take care of the children need to go back to work are getting. So this is helping to protect them and helping them to get back to school, because the kids need to get back to school. Children are really suffering right now, especially the adolescents, going through a lot of anxiety and depression. So as a pediatrician, that's how I see it. It's a hope for us to start healing. Yeah.
And as Dr. Johnson mentioned, yeah, we don't have the vaccines for kids under the age of 16, but there are current studies right now going on between the ages of 12 and 17, I believe. So hopefully in the future, we'll get the vaccine for our younger pediatric population. And it's really important that we do keep our pediatric patients safe and away from COVID as much as possible. We know how they are. They like to touch and lick things they're not supposed to, but they can get really, really, really sick from the virus, just like the adults can. So it's really important that we do vaccinate ourselves so that we can protect the younger.
That's what we can do right now for our children.
That's right. As adults, we can protect our children.
Taking responsibility and getting vaccinated so we can protect our children.
Absolutely. Okay. Absolutely. And then again, final remarks, if we can each take about 30 seconds.
Oh, you want to start in order? I'm sorry.
Yeah, Dr. Jermaine and Jeremy Hogstrom.
And so I just kind of want to say that, you know, from the historical standpoint, I mean, you know, there is a lot of reason as to why, you know, our fellow African Americans can be or may have skepticism when it comes to trusting the healthcare system. But, you know, kind of by participating in events like this here, I'm kind of, you know, hopeful that we can help rebuild that trust. And so, you know, I feel like this is a really great way that we can help reach out to people and show them that there are people in medicine that represent them and that look like them. So yeah. And likewise, you know, I went into medicine overall because of reasons like this right here. I think that's why both of us really went in, is because we want to be part of that. You know, we do hear so much about the distrust, and very much understandably so, that has been, you know, broken. And so the way I see it is, you know, somebody has to be part of the solution, right? And so that's why I want to be here, and that's what, you know, ultimately I want to do for the rest of my life, is to help, again, rebuild that trust in the African American community so that we can be overall, you know, have better health, have better outcomes from what we're currently seeing now. And so it's very important that with us being here, you know, we can be the voices of the ones that are not able to have that voice. And so I'm it brings me overall, you know, great satisfaction to be able to be in the position that I am. So
perfect. Dr. Okoye?
Yes, I am so happy to be in the presence of my esteemed colleagues, and also just happy to be able to do this for so many reasons. One, because I can look and say, you know, this, me looking at you guys and, you know, and seeing younger me, the older pudgy me, you know, see someone, you know, look like us in this position to be able to not only be in the position to help, but also to help in, you know, physically in person, but also to disseminate information, to really be a giver of knowledge. And so I'm just grateful for this opportunity. I'm also thankful because I think it's appropriate that we're doing this on Martin Luther King Day, per what Dr. Lee Allen mentioned. It's just because we know Martin Luther King's renowned history of public service, civic engagement. He saw rights for every individual, whether it was economic, civil, and health rights in healthcare. Saw it for everyone, but he outlined when there are people who were in dire need, and that's what we are here to do. We're here to give specific spotlight to the areas that were devastated. The numbers are not lying. We are seeing we have a group, a community that is devastated, not because of the virus itself, but because of inequity, because of structural issues that have been present.
For hundreds of years.
Yep, absolutely. And so I'm just grateful to be in a position to where I can help to enlighten people on it and also to help to overcome it.
Absolutely. So Dr. Williams, and we have left Dr. Williams, as well as Dr. McPherson and Urota and Dr. Evans. And I'll just say, we just need to quicken our pace just a little bit as in our final remarks. Go ahead, Dr. Williams.
I will say thank you to all of the attendees. And I hope that you guys found this information to be very helpful and very informative. And I hope that you guys will really, take the information and really, consider, getting vaccinated and, encouraging your family, friends, and loved ones to get vaccinated. So I would just say, please utilize this information wisely and try to make a very informed decision for yourself and your family members.
That's right. Spread the word. Spread the word. And Dr. Urota and Dr. McPherson, do you want to give final words?
So I see currently we have 232 participants, and that is really my hope is that you all take this information and carry that on and share with your loved ones. That's really what this is all about. Health disparities have been amplified by this virus. We already knew things like this were here, and we're so grateful that we're able to address them tonight. So thank you for coming. Thank you for listening. Please spread the word.
I just want to say I'm just very grateful to have this a platform to be able to give out the correct information. There's a lot of misinformation out there, and we want you guys to be able to make an informed decision, but you can't make an informed decision by misinformation, reading multiple Facebook posts or anything like that. So that's why we wanted to come together and give you guys the correct information regarding the vaccine. If you guys, like I said, this is not the last you'll see of us. So if you guys have more questions, you can reach out to us on our social media platforms. But I just really hope that everyone took the information tonight, think about it, spread the message to other of your friends and family, and let's slow this thing down. Let's try to get to some sense of normalcy.
Absolutely. And then Dr. Evans and Dr. Ikwezuma. You're on mute, Dr. Evans.
I am. I'm on mute. That's been my problem as we all got together.
That's okay. That was a reminder to be quick.
I mute myself. So, Dr. Martin Luther King, 1966. Of all the forms of inequality, injustice, in healthcare, right, the most shocking and inhumane.
That's right.
That's where we are now. We're still at this place right now. And I think that it speaks volumes that although we are physicians here, we still make less than 6% of the physicians across the US as African Americans. So when you see us talking about the vaccine, we are serious about helping you. We're serious about influencing your decisions. We are serious about seeing a change in terms of African Americans being the top and most severe when it comes to disease and illness. So thank you guys. This is awesome.
And Dr. Ikwezuma.
So I just want to thank everybody, my colleagues, for participating in this conversation that, in my mind, needed to be had. One of the things that I hope that several of the panelists, or actually attendees rather, realized when they participated is that you have diversity of location and also diversity of thought within this panel. But we're all focused on making sure that we answer and give you the information accurately. Also for my pregnant moms, if you didn't feel like you had your questions answered, feel free to reach out to us on our social media platform. Like we said, this isn't the last that you'll hear from us. Also to those lactating moms or those moms that plan on, having a child soon, we have our pediatrician and neonatologist colleagues here that are, I call them the Smurfs, but they are available to answer questions as well. And we'll hopefully look forward to engaging with you in the future.
And last but not least, again, I just want to say the bottom line is it's about self-determination. And we as a community are all together and we are unified and we have to act together. We have problems that have been presented upon us and have happened for centuries. But still in all, I like to say that African Americans are the people who are against all odds, excellence. Let us continue that legacy. Each and every one of us have that responsibility. We will press forward and this too shall pass. Thank you, good night, and God bless.
Thank you.
We got some that were planning to vaccinate, wasn't sure, but now I plan to.
Because that's what happens.
We're still open.
All right, sorry for the technical difficulties, guys, but please see your way out.
Yes, we're counting down, 84, 85, y'all got to go.
You don't got to go home.
Y'all got to close the Zoom for us.
You don't have to go home, but can't stay
Y'all
here.
got to close the Zoom.
They're already home, they're probably.
Well, just text me that we are still up. Kanisha.
Huh?
I just got a text that we are still up.
Oh.
On live? On
Yeah.
Facebook Live.
She said we need to. Erica.
Wait, I didn't know we